I've been looking for someone to help me with this for a very long time.
My name is Dr. Kennedy Tercy, and this is Two Palms Medical Center, a specialized practice in Southern Texas focusing exclusively on gynecomastia removal surgery and male aesthetics. In this video, we're gonna be following the journey of a professional bodybuilder with single-digit body fat getting his gynecomastia removed. Now to introduce our patient.
I am 5'7". I'm 188 pounds currently. I am 34 years of age.
And when did you first notice that you might have gyno?
2021, 22, I think. That's when I noticed it, when I started getting into bodybuilding around that time. My hormonal therapist gave me the test. I started using it, and there wasn't any AI in the kit at that time.
Aromatase inhibitors.
Yeah, sorry. There was no AI in there. And I think maybe at that time, they might have thought that I'm on such a small dosage and they didn't think I need it. So I was taking the shot without any AI. And then what happened was I started feeling some sensation. I couldn't prevent it, it just started growing more and more and more. And the only time I saw it subside was when I completely get off it. And it's been like that since 2020, all the way till now.
We are about to start our gynecomastia case for today. You can pretty clearly see where the glands are. He's really well developed muscularly, so this kind of downward hanging anatomy here is pathologic, meaning abnormal. So really we're just gonna prioritize being very careful in our dissection, just identifying the anatomy that's not supposed to be there and removing it very carefully. We're gonna mark him out now. So we mark out our sternal notch. We make our access points at the 3, 6, 9 o'clock position of the areola. I'm gonna make 2 dotted lines around the perimeter of the gland. The interior dotted line is gonna be as close to where the primary portion of the mass is, and then the second dotted line outside is gonna be kind of the limit of the anesthesia. So that is our preoperative plan, and we're about to get the case started. In regards to this patient's surgery, one of the decisions we made was not to do any liposuction. In his case, his body fat levels were so low that it would have been counterproductive. The last thing we want to do is create more scar tissue than necessary, where the liposuction is going to have minimal benefit. Moving on to how we did the surgery, we started with a timeout, like we do all surgeries, where we make sure that all the preoperative items that needed to be done were completed, that he took his preoperative antibiotics, that his skin was prepped, the sterile fields created, and he's been adequately sedated. Then we move on to the surgery, which starts with numbing the chest. Using the anesthesia, we pump all the fluid into the chest area so he doesn't feel any of the cuts or any of the surgical process. The analogy I've used before with other patients and in other videos is this surgery is akin to a robbery. We're trying to sneak in, remove exactly what needs to be taken, with leaving minimal signs that anything was done. How much of yesterday do you remember?
I'd have to say I did remember going in and out quite often, honestly. And the process was, it was very painless. There was no pain at all. I felt very, almost at home, comfortable. Mm-hmm. Yeah, I had no worries at all.
This is our patient one day after surgery. He's taking off the compression garment. He has the bandages in place. He had more scar tissue than normal, but overall his appearance is what we'd expect one day after gynecomastia surgery. Because we didn't do any liposuction, we didn't place any drains in the axilla, so the patient did have more fluid collect in the operative area than most other patients do, which is not a problem. We just drain it with a needle, no big deal. We do that with all other seromas after the drains are removed. And for him, it persisted until about week 4 to 5 is when he had the last of the seromas that needed to be evacuated. For this patient, we ultimately utilized Kenalog. Kenalog is a non-anabolic steroid that breaks down scar tissue. In this part of the video, you could see me injecting it into the most prominent areas of scar tissue around the surgical site. The thing with Kenalog that we need to be mindful of is skin blanching or skin bleaching. With someone with a skin tone as dark as his, that's something you really want to be mindful of. So the way we mitigate this is by being judicious in the volume of the Kenalog we use and by not overdoing it in terms of frequency. So this is like a true case of TRT-induced gynecomastia.
Yeah. I've always been an athlete. Back in college, because I used to play soccer. When I was in my 23, 24, around there, I remember tearing my groin. And I started having joint pains. So I went to see a doctor in Florida, and they told me the injury that you have occurred, you could fix it by training and getting those leg ligaments stronger, especially my knees. They recommended that I get into weightlifting.
Do you recall what dose you were doing?
Yes, I do. So I was doing testosterone ethynate, and I was only prescribed 150 milligrams per week. It took a toll on my body. So if you're getting into this, I recommend that you get professionals that are more knowledgeable than you, that can assist you make the right decision, and also make sure you get the right dosage as well.
Okay.
Yeah.
So it sounds like one big take home from this is that if you're considering doing TRT or exogenous testosterone, you really need to be ready with an aromatase inhibitor up
Yes,
front.
absolutely.
This is our patient 4 months later. He is a gentleman that already had an elite physique before the surgery. Now, mind you, when we first met him, he was in his cutting phase, so his body fat levels were incredibly low. Seeing him at the 4-month post-op mark, he's currently in a bulking phase. So his body composition has changed a little bit, but the dramatic difference is in his chest. For somebody that competes on stage, judges know exactly what gynecomastia is, and unfortunately they would dock points for something like this. But looking at him now, his chest looks completely normal. When he raises his arms, he feels a little bit of scar tissue and firmness, but with his arms down, there's no signs that any surgery was done. And I'm confident that as the months go on, even when he raises his arms, his results are gonna be pretty much flawless. This is about as good as it gets. There's no caved appearance, there's no sunken in, there's no signs of surgery. I'm very happy with the result. The patient's very happy with the result, and he's gonna be competing for his pro card later this year. I wanna thank our patient for letting us use his footage as a part of this video. There's a lot of trolls on the internet that comment about gynecomastia. They'll say things like, this person just needs to do more push-ups, this person needs to get into better shape. But this gentleman is proof that gynecomastia a lot of times is not a fitness problem. It's a gland. It's not related to fat, it's not related to muscle. This gentleman has all the muscle in the world and no body fat whatsoever, but yet still has gynecomastic glands. So for those trolls on the internet, ignore them, disregard them. If you have gynecomastia, do your research. If you want educational content, then check out our channel. And if you have gynecomastia and you want surgery, then reach out. A phone consultation with yours truly is free. All you have to do is hit the link below to schedule that free phone consult. Otherwise, gynecomastia is a treatable problem, and we're here to help.